Hello, everybody. My name is Dr. Freddy Garcia. Today I'm joined by Dr. Richard Kowal. Dr. Kowal, thanks so much for joining me today.
Hi, how are you, Freddie? It's good
I'm
to see
doing
you.
great. I'm doing great. We're recording a quick webinar, and the topic today is going to be how to grow your practice using transcutaneous pulse radio frequency and the STIMPOD NMS460. And I'm excited to learn from you because you are a bit of a legend.
Thank you. I have been using StimPod for about 10 years, and I can say that it's a tool that grows in importance as you develop technically.
Yeah, that's incredible. And this is exactly why I wanted to record a video with you, because you do have over 10 years of experience using transcutaneous pulse radio frequency. But before we jump into some of the clinical applications that you started exploring with the StimPod, can you please tell us a little bit about yourself, your interest, and I definitely want to hear about your practice.
Okay. So I studied human development at Cornell for my undergraduate studies. I have a master's in clinical nutrition from the University of Bridgeport, and I've been practicing as a chiropractor for over 40 years. I got my degree at New York Chiropractic College. My interests outside of practice are varied, but also often related to the kind of work that we do as DCs and PTs. I'm a black belt in Taekwondo,
Oh,
and
wow.
I've been studying yoga for and practicing yoga for over 25 years. So I have a big interest in all kinds of physical practices that relate very much to the kind of work that we do as chiropractors and DPTs.
That's incredible. That especially the Taekwondo, you caught me by surprise there. What about your practice? Can you share a little bit about your practice? What's that's like? What are the things that you're working with and treating there, or your favorite things to tackle?
I treat a broad variety of musculoskeletal problems, probably similar to everybody watching this webinar. There's, of course, all the arthritic related neck and low back pain, and then all the interesting extremity problems that people have, either just from getting older or from exercise injury, really a large variety of problems. And I use a wide variety of musculoskeletal techniques, including myofascial techniques, non-force spinal manipulation, and of course, StimPod is central to much of what I do in practice.
That's excellent. And the fact that you have this much experience and it is central, this is why I'm eager to learn from you. But before we get into the meat and potato of things, I want to ask you, Dr. Cowell, if somebody's just hearing about the stim pod for the first time, how do you describe what it is? If somebody's like, "Hey, what is this thing? What's the stim pod NMS460?" How do you answer that?
So if you look up pulsed radio frequency, most of the articles that you're going to read, and there is a large literature around the use of pulse radio frequency stimulation, will be percutaneous pulse radio frequency. This means that practitioners, mostly physiatrists and anesthesiologists, are using needles injected into a nerve and then putting pulse radio frequency directly into the nerve to stimulate it. But StimPod, which can be used by DPTs and DCs, is transcutaneous pulse radio frequency. That means that we're not puncturing the skin. We're using the StimPod device, which has a stylus with a kind of soft tip, much like the end of a ballpoint pen, to stimulate points. The points can be over peripheral nerves, it can be over areas of pain, and that's pretty much how we approach using StimPod.
Okay, excellent. Great. So let's get right into it. Can you speak about why clinicians need a stim pod NMS460 in their practice?
Yeah. So patients ask me occasionally, how did you develop your techniques? Do they teach all of this at school? And the way I generally respond is you learn a good basis for patient care at school, but over time in practice, you encounter problems in patients that don't respond to your typical approach, whatever that is. So at least for that patient, you have to figure out a better approach. And often we do. And when we do figure out that approach for a patient with this kind of problem, what we're going to do is we're going to try that same approach with every patient that comes in who has a similar problem. So in that way, you slowly improve 5%, another 5%, 5%, 5%. You get better, 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 and your techniques become more and more specific and effective. What's great about STIMPOD is with almost any patient, even with a little bit of training, you're going to get 10%, 20% better with that patient, and often quite a bit more than that. So it's not a Me Too device that replaces something that you're already doing. It actually expands your practice. It lets you treat problems that you're not currently treating.
That's interesting. So those are the things that I really want to dive into. So let's go even deeper and let's get more specific. Can you speak to how you use the StimPod in your practice? And I definitely want to hear about those things that may be a little innovative to those who are looking at the literature and seeing where it kind of lives and then going, wow, there's different areas that you could explore. Because I know you, with 10 years of experience, I think that's really cool that you have been exploring.
Okay, so let's jump in. I wanted to discuss four important and unique ways that StimPod can be used in practice, the way I use it in practice. Although, if you get a StimPod, you will discover some things that I don't know. And then we'll talk about that and we'll all get a little better. But here's how I use it in practice. First, StimPod can be used directly over areas of pain, and it will almost always have an immediate analgesic effect by reducing pain signals that are sent to the brain. These areas of pain in patients, the soft tissue, are almost always palpable as densities. And these densities, as we know, come from spasm, myofascial tension, post-surgical or post-injury adhesions, or inflammation. But some of the analgesic effect is a direct effect on nerve tissue, either free nerve endings or actual peripheral nerves. So what does this mean in practice? Let me give you some examples. SI joint pain, pain above the waist, not into the buttock, not into the legs, SI joint pain. In this case, when we use StimPod, we're treating inflammation. So you can't see it because it's in the SI joint. It's deep. You can't feel it, but we know from experience that StimPod can be used directly over the SI joints. And typically, I'll treat both SI joints for about 5 minutes each, and there will be an immediate and very significant improvement in SI joint pain. So that's an example of treating inflammation with StimPod. Another example would be treating buttock pain. It could be from gluteal tendinopathy. It can be from sprain. It could be from overuse. In this case, you're actually palpating dense areas in the glutes, and they'll be painful to pressure, extremely painful. Patient will report. We can treat those points directly. So we're treating dense areas in the glutes, and those points will soften and become immediately less painful, both to palpation and when a patient moves. Another example of treating pain would be scapular pain. In this example, we're generally treating pain that's referred from cervical nerve roots, but once it's in the muscle, it's living in the muscle. And we can treat the scapular pain and the upper back pain directly with StimPod. So those are 3 examples of treating areas of pain directly with StimPod. The SI joints, you're treating inflammation. In the buttocks, you're treating dense areas that can represent what we used to call trigger points. And in the scapula, we're treating referred pain that's coming from the cervical spine, cervical nerve root compression. Another example of using StimPod in a completely different way, and this may be something that you're not currently doing at all, is treating neuropathic pain. What does this mean? You can treat patients with diabetic foot neuropathy, which is entirely neuropathic, and doesn't really respond to typical rehab strategies. Before I had STIMPOD, I would get calls about from patients with diabetic foot neuropathy who asked if they could come in. I didn't let them come in because I had nothing to offer them until I had STIMPOD. I can now treat diabetic foot neuropathy. Do I win 100% of the time? No, but I win a significant amount of the time. And even if I can't clear it out 100%, I can often clear it out to a degree which makes patients a lot more comfortable, lets them sleep at night. Patients generally will be happy that they came to you for that kind of treatment. Another example of neuropathic pain is something that I've just begun to do. I had read an article about percutaneous PRF being used to treat post-surgical knee pain after total joint replacement. So that was interesting to me. I recently had a patient referred by an orthopedist with what the orthopedist thought was just iliotibial syndrome. It was more complicated than that, although it included the ITB. But after I did the myofascial work and stretching that I would often or almost always bring to that kind of patient, I decided in the context of this article I had just read for treating neuropathic knee pain to treat the points associated with sensation in the knee with STIMPOD. In this case, I was treating the femoral nerve in the inguinal region and the tibial nerve just above the popliteal space. And I got another 50% bump in pain relief after treating just those 2 points. So now, of course, with every patient who comes in with knee pain, even if it's clearly a mechanical issue, I always treat the neuropathic component because why not? I can do it with STIMPOD. So I think that's a terrific example of using this device to expand your practice and help patients. So we talked about treating pain directly, treating neuropathic pain. It can also be used, and I think this is very interesting, to treat neuropathic weakness. And briefly, what I've learned is that pulsed radiofrequency modulates calcium levels in tissue, local tissue, so around nerves. So there are a lot of calcium-dependent peptides and proteins that play roles in nerve regeneration and synaptic communication. And for those that want to learn more about this, we'll leave a link at the bottom of the webinar. But what does this mean in practice? So with STIMPOD, you can now treat patients who have residual foot drop. For example, after surgery from central stenosis in the lumbar spine. In the past, before STIMPOD, I would never have let those patients come into my practice, although I did used to get calls because I had nothing to offer them. Now with STIMPOD, I can at least begin to try and treat the residual foot drop. You won't win every time, but you'll win many times, and patients will begin to have on a spectrum improvement in foot strength to the point where they might be able to let go of the brace and even the cane. So I've had some patients with complete resolution, and again, like many things, improvement on a spectrum. As long as we're talking about
when I started hearing about you, these are some of the legends I heard about you about helping these patients with foot drops who have gone everywhere else, and then you're able to find them a solution. And that's so years ago. That's when I started hearing your name. You got quite the reputation for some of those challenging cases, which is so cool to hear right from you.
So in the last year, another example of treating neuropathic weakness that I hadn't even thought of before has to do with watching my older patients walk in. I always watch when patients come in, how they come in, how they sit, stand, and often you'll see older folks who just kind of wobble. They have a weaker leg. They may not be using a cane, but they don't look really steady to you with the kind of eyes we have. It could be that other people look at them and they look fine. But when you guys and I look at them, we can see that they're wobbling a little. So what I've recently begun to do is to try and strengthen the quadriceps on the weaker side by treating the femoral nerve. And interestingly, with older patients who didn't even come in with that as their major complaint, can sometimes have improvement in the quality of their walking simply by treating the femoral nerve on the weak leg side. I've had patients come in wobbling as they come in and then walking with much more steadiness as they leave, just better walking gait. Um,
That's incredible.
I can't think of another way to do that
Right.
that isn't StimPod. I mean, if that was the only thing that you got from StimPod, that would be significant. It would make you feel pretty good. The last way I use StimPod is treating cervical spine arthritic facet joint inflammation. So this is a patient that I think we all see frequently in practice. This is someone who's 70, 80, 90 with severe cervical spine arthritis and painful rotation especially. They may have less than 10 degrees of rotation. They may have 5 degrees of rotation with strong pain throughout that tiny range. And these are fragile patients. They have osteoporosis. These are patients that you feel like, oh, I got to be really careful. I don't want to hurt this guy. But with StimPod, you can treat directly over the posterior cervical facet joints. And right after that treatment, during the treatment, you may get 20 to 40 degrees of rotation and immediate pain relief after treatment. And then a patient will say, well, I get to keep it. Well, you'll keep some of it, you'll lose a little bit, but you're not going to go back to where you were. And then, like many things, it'll be a stair step of improvement as you treat. So again, it's an example of using StimPod to treat a problem that you really can't treat that well right now. And that's why we use the title of how to use StimPod to expand your practice. So
That's all. Just those applications alone are really good because I want to invite people to realize what it is easily knocks out of the park, but also start exploring some other ideas. And that's why your experience is, is,
exactly.
is, is great.
Yeah.
Dr. Kowal, let me ask you this. As I'm hearing the way you apply the StimPod NMS460 in your practice, a lot of the times you're saying that you expect these changes and they seem very dramatic. And I'm interpreting, but I want to hear directly from you that these changes happen very quickly. But am I erroneous to even think that? But it sounds like these changes are expected to happen fairly quickly. How quickly do you expect these for the patient to perceive a decrease
Yeah.
in pain, sometimes up to 50%, you're saying in a treatment? How quickly does he expect
Right.
it to happen?
It depends, like many things, on how old the patient is, how long they've had the problem, and the underlying issue that's causing the problem. So in the case of the patient I mentioned with severe low back pain coming from the SI joints, you will get an immediate, very strong improvement, I mean, 80 to 100% right after
Wow.
treatment. With the older patient who had surgery for central stenosis 5 years ago and has been left with foot drop, you are not going to get an immediate improvement. You'll see that patient, 8 to 20 times, although typically, if I don't get at least some improvement after 6 treatments, I will not continue. So depending on the problem that you're treating, you can get very quick results. Another example of the very quick is that 80-year-old with cervical spine arthritis and almost no range of motion. That's immediate improvement. They will walk out the door with immediate improvement. Diabetic foot neuropathy, that's going to be over time. And you'll see, hopefully, incremental improvements which become significant over time. So again, it depends on what you're treating, how long it's been there, the underlying condition of the patient, et cetera. We all know that.
Excellent. This is a gift that you're sharing your experience with everybody. Dr. Kowal, is there anything else that you want to add in regards to how to grow your practice using technology like the STIMPOD NMS 460?
I think the most important point that I want to make is that this won't just replace some of the techniques that you're currently using and make you 5% better in the example that I was using before. There are some problems that you can treat with StimPod that you couldn't treat with any of the approaches that you've been using up until now. And I think that's very exciting. And in that way, it expands your practice. You'll feel more comfortable letting patients come in to treat issues that you couldn't treat in the past. Where does it shine? Our bread and butter patients, neck and upper back, scapular pain, reduced range of motion, low back and buttock pain, sciatic line pain, paresthesia, neuropathic weakness, neuropathic foot pain. But the key point that everybody should walk away with is that it's safe, immediate, and painless. So I urge you to consider bringing StimPod into your practice. And I have no doubt that within a few years, we'll be learning things from you because it's a creative tool. You will have patients that come in where you're stuck and you decide, I haven't used StimPod in this way before, but I'm going to see if I can squeeze a little bit more improvement, adding StimPod to the treatment. And inevitably that will happen. And then you'll share your results with us and we'll all grow.
That's excellent. Yeah, that it will undoubtedly happen, especially since I think you're going to inspire people to, bring on the STEM pod and then explore the way you have for the over 10 years. Dr. Kowal, if somebody wanted to learn more about you or contact you, how do they do that?
Please attach my email and I'll be happy to get back my phone and speak with anybody that has an interest if they want to discuss a patient or just talk about how they might quick start integration of StimPod into practice if they're going to get it. We can talk about that. I can talk about, how to use it in the easiest way on Monday after you get it Friday, and then, help to guide people to use it in a more comprehensive way as they become more skilled and confident with it. So yeah, please put my email
Uh,
in the
we'll,
webinar.
we'll do, Dr. Kowal. Dr. Kowal, I want to personally thank you on behalf of Algemed for spending some time with us today and sharing your over 10 years of experience using tPRF therapy with the StimPod NMS460. I'm glad I finally got to connect with you because, like I said, I've been hearing amazing stories about the results and outcomes you've been delivering to your patients. And I just want to thank you for exploring and thinking out of the box. And I hope that you inspire other people to explore the same way you did, so we could all get better together and serve the patients that need our help around the world. So thank you so much for your time today.
Thank you for hosting me.
Yeah. To everybody, I hope you enjoyed this quick webinar. And again, we'll leave Dr. Kyle's email address somewhere on the page or email, and we'll catch you at the next one. Thank you again, Dr. Kyle. Have a great day.